Hi everybody and welcome to my channel Hobit BB. Earlier I posted a short video about an overview of chronic obstructive pulmonary disease. I hope you have seen that video already, and today I am going to present a detailed video about this problem. So let's discuss this. Chronic obstructive pulmonary disease is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Symptoms include breathing difficulty, cough, mucus, which is sputum production, and wheezing. It is typically caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. People with COPD are at increased risk of developing heart disease, lung cancer, and a variety of other conditions. Emphysema and chronic bronchitis are the two most common conditions that contribute to COPD. These two conditions usually occur together and can vary in severity among individuals with COPD. Chronic bronchitis is inflammation of the lining of the bronchial tubes, which carry air to and from the air sacs, which are alveoli of the lungs. It is characterized by daily cough and mucus production. Okay. Well, emphysema is a condition in which the alveoli at the end of the smallest air passages, which are known as bronchioles of the lungs, are destroyed as a result of the damaging exposure to cigarette smoke and other irritating gases and particulate matter. Although COPD is a progressive disease that gets worse over time, COPD is treatable. With proper management, most people with COPD can achieve good symptom control and quality of life, as well as a reduced risk of other associated conditions. Now, let me tell you the symptoms of COPD. COPD symptoms often do not appear until significant lung damage has occurred, and they usually worsen over time, particularly if smoking exposure continues. Signs and symptoms of COPD may include shortness of breath, especially during physical activities, wheezing, chest tightness, a chronic cough that may produce mucus, which is sputum, that may be clear, white, yellow, or greenish. Frequent respiratory infections also can occur. Lack of energy, unintended weight loss, especially in later stages. Also, there could be swelling in ankles, feet, or legs. People with COPD are also likely to experience episodes called exacerbations, during which their symptoms become worse than the usual day-to-day variation and persist for at least several days. Talk to your doctor if your symptoms are not improving with treatment or getting worse, or if you notice symptoms of an infection such as fever or a change in sputum. You should seek immediate medical care if you cannot catch your breath, if you experience severe blueness of your lips or fingernail beds, which is known as cyanosis, or if you suffer from a rapid heartbeat, or if you feel foggy and have trouble concentrating. Now let me tell you the causes. The main cause of COPD in developed countries is tobacco smoking. In the developing world, COPD often occurs in people exposed to fumes from burning fuel for cooking and heating in poorly ventilated homes. Only some chronic smokers develop clinically apparent COPD, although many smokers with long smoking histories may develop reduced lung function. Some smokers develop less common lung conditions. They may be misdiagnosed as having COPD until a more thorough evaluation is performed. Now I'll tell you how your lungs are affected. Air travels down your windpipe, which is trachea, and into your lung through two large tubes, which are bronchi. Inside your lung, these tubes divide many times, like the branches of a tree, into many smaller tubes, which are known as bronchiole, that end in clusters of tiny air sacs, which are known as alveoli. The air sacs have very thin walls full of tiny blood vessels, which are known as capillaries. The oxygen in the air you inhale passes into these blood vessels and enters your bloodstream. At the same time, carbon dioxide, which is a gas that is a waste product of metabolism, is exhaled. Your lungs rely on the natural elasticity of the bronchial tubes and air sacs to force air out of your body. COPD causes them to lose their elasticity and overexpand, which leaves some air trapped in your lungs when you exhale. The causes of airway obstruction include emphysema. This lung disease causes destruction of the fragile walls and elastic fibers of the alveoli. Small airways collapse when you exhale, impairing airflow out of your lungs. Chronic bronchitis. In this condition, your bronchial tubes become inflamed and narrowed, and your lungs produce more mucus, which can further block the narrowed tubes. You develop a chronic cough trying to clear your airways. Cigarette smoke and other irritants. In the vast majority of patients with COPD, the lung damage that leads to COPD is caused by long-term cigarette smoking. But there are likely other factors at play in the development of COPD, such as genetic susceptibility to the disease, because not all smokers develop COPD. Other irritants can cause COPD, including cigar smoke, secondhand smoke, pipe smoke, air pollution, and workplace exposure to dust, smoke, or fumes. And then there is a condition known as alpha-1 antitrypsin deficiency. In about 1% of patients with COPD, the disease results from a genetic disorder that causes low levels of a protein called alpha-1 antitrypsin. Alpha-1 antitrypsin is made in the liver and secreted into the bloodstream to help protect the lungs. Alpha-1 antitrypsin deficiency can cause liver disease, lung disease, or both. For adults with COPD related to alpha-1 antitrypsin deficiency, treatment options include those used for people with more common types of COPD. In addition, some people can be treated by replacing the missing alpha-1 antitrypsin protein, which may prevent further damage to the lungs. So these were the causes. Now I tell you the risk factors. The risk factors for COPD include exposure to tobacco smoke. The most significant risk factor for COPD is long-term cigarette smoking. The more years you smoke and the more packs you smoke, the greater your risk. Pipe smoker, cigarette smoker, and marijuana smoker also may be at risk, as well as people exposed to large amounts of second-hand smoke, which is also known as passive smoking. Then another risk factor is people with asthma, which is a chronic inflammatory airway disease, and this is a risk factor for developing COPD. Well, on my channel with BB, I have posted a video about asthma, okay, and please see that video. That is very, very helpful and video for everybody, okay, especially for the patients who are suffering from asthma, okay. So please see that video, that is very useful, okay. As I was telling you about the risk factor of asthma, the combination of asthma and smoking increases the risk of COPD even more, okay. And then another risk factor is occupational exposure to dust and chemicals. Long-term exposure to chemical fumes, vapors, and dust in the workplace can irritate and inflame your lungs. Exposure to fumes from burning fuels. In the developing world, as I told you before, people exposed to fumes from burning fuel for cooking and eating in poorly ventilated homes are at high risk of developing COPD. Genetics. The uncommon genetic disorder, which is alpha-1 antitrypsin deficiency, is the cause of some cases of COPD. Other genetic factors likely make certain smokers more susceptible to the disease. Okay, these were the risk factors. Now I'll tell you the complications. Complication can cause many. COPD can cause many complications, including respiratory infections. People with COPD are more likely to catch colds, the flu, and pneumonia. Any respiratory infection can make it much more difficult to breathe and could cause further damage to lung tissue. Well, recently I have posted a video about pneumonia on my channel with BB. Please see that video. That is also very important and useful video. Okay. Another complication is heart problems. For reasons that are not fully understood, COPD can increase your risk of heart disease, including heart attack. Then there is another dangerous complication, that is lung cancer. People with COPD have a higher risk of developing lung cancer. High blood pressure in lung arteries. COPD may cause high blood pressure in the arteries that bring blood to your lungs, which are pulmonary arteries, and the condition which develops is pulmonary hypertension. Okay. Depression. Difficulty breathing can keep you from doing activities that you enjoy, and dealing with serious illness can contribute to the development of depression. Well, depression has so many other causes, and I have also posted a video about depression on my channel with BB. That's also very helpful video, and please see that video, which is very, very useful. Okay. Now let me tell you the preventive measures against COPD. Unlike some diseases, COPD typically has a clear cause and a clear path of prevention, and there are ways to slow the progression of the disease. And the majority of cases are directly related to cigarette smoking, and the best way to prevent COPD is to never smoke or to stop smoking now. If you are a long-term smoker, these simple statements may not seem so simple, especially if you have tried quitting once, twice, or many times before. But keep trying to quit. It is critical to find a tobacco cessation program that can help you quit for good. It's your best chance for reducing damage to your lungs. Occupational exposure to chemical fumes and dust is another risk factor for COPD. If you work with these types of lung irritants, talk to your supervisor about the best ways to protect yourself, such as using respiratory protective equipment. Also, I should tell you some steps that you can take to help prevent complications associated with COPD. You should quit smoking to help reduce your risk of heart disease and lung cancer. Well, on my channel, I have posted a video which is in Urdu, and to help quit smoking, because when we tell patients about dangerous consequences of smoking, they do not quit, but there is a secret method to quit smoking, and that is really helpful. So if you can watch that video, that will be useful. Okay. You can get an annual flu vaccination and a regular vaccination against pneumococcal pneumonia to reduce your risk of or prevent some infections. You should talk to your doctor if you feel sad or helpless or think that you may be experiencing depression. Okay. So these were the complications. Now I'll tell you the diagnosis. COPD is commonly misdiagnosed. Many people who have COPD may not be diagnosed until the disease is advanced. To diagnose your condition, your doctor will review your signs and symptoms and discuss your family and medical history, and discuss any exposure you have had to lung irritants, especially cigarette smoke. Your doctor may order several tests to diagnose your condition. Okay. Well, here I should tell you the tests which we order. Okay, in order to diagnose COPD. These tests include lung function test. These tests measure the amount of air you can inhale and exhale, and whether your lungs deliver enough oxygen to your blood. During the most common test called spirometry, you blow into a large tube connected to a small machine to measure how much air your lungs can hold and how fast you can blow the air out of your lungs. Other tests include measurement of lung volumes and diffusing capacity, 6-minute walk test, and pulse oximetry. Chest X-ray. A chest X-ray can show emphysema, one of the main causes of COPD. An X-ray can also rule out other lung problems or heart failure. Then we may order CT scan. A CT scan of your lungs can help detect emphysema and help determine if you might benefit from surgery for COPD. CT scans can also be used to screen for lung cancer. Arterial blood gas analysis, that is ABE. Okay, this blood test measures how well your lungs are bringing oxygen into your blood and removing carbon dioxide. Laboratory tests. Lab tests are not used to diagnose COPD, but they may be used to determine the cause of your symptoms or rule out other conditions. For example, lab tests may be used to determine if you have the genetic disorder alpha-1 antitrypsin deficiency, which may be the cause of COPD in some people. This test may be done if you have a family history of COPD and develop COPD at a young age. Okay. And now I should tell you the treatment. Many patients with COPD have mild forms of the disease for which little therapy is needed other than smoking cessation. Even for more advanced stages of disease, effective therapy is available that can control symptoms, slow progression, and reduce your risk of complications and exacerbations, and improve your ability to lead an active life. The first and most important is quitting smoking. The most essential step in any treatment plan for COPD is to quit all smoking. Stopping smoking can keep COPD from getting worse and reducing your ability to breathe. But quitting smoking is not easy, and this task may seem particularly daunting if you have tried to quit and have been unsuccessful. Well, as I mentioned already, on my channel I have posted a video in Urdu how to quit smoking, and that is a good solution. It's a secret method sort of that which we tell to some patients, because when we tell about dangerous effects of smoking, they do not quit. But when we tell about this one, then and some people quit very quickly. Okay, so you can see that video. Also, you should talk to your doctor about nicotine replacement products and medication that might help, as well as how to handle relapses. Your doctor may also recommend a support group for people who want to quit smoking. Also, avoid second-hand smoke exposure whenever possible. Coming to the medication, several kinds of medication are used to treat the symptom and complication of COPD. You may take some medication on a regular basis and others as needed. It's like the medication are almost similar to the treatment which I mentioned in my video about bronchial asthma. You can see that video, and also I should tell some about some medication in this video as well. Okay, what I was telling you, that medications are almost similar in this for the treatment of COPD, just like asthma. Okay, the first is that bronchodilators, which are medications that usually come in inhaler. They relax the muscle around your airways. This can help relieve coughing and shortness of breath and make breathing easier. Depending on the severity of your disease, you may need a short-acting bronchodilator before activities, or a long-acting bronchodilator that you use every day, or both. Examples of short-term bronchodilator include albuterol, which comes with the name of Pro-Air HFA, Ventolin HFA, and others. Aprotropium, which comes with the name of Atrovent HA. Levalbuterol also, which comes with the name of Zopinex. Okay, there are also examples of long-acting bronchodilator, which include acetylenidium, which comes with the name of Tudorza, Pressor, and then formoterol, this Performist. Okay, and salmeterol, Ceravent, which comes with the name of Ceravent, and some others. Okay, then there is the treatment option of inhaled steroids. These can reduce airway inflammation and prevent exacerbation. Side effects may include bruising, oral infection, and hoarseness. These medications are useful for people with frequent exacerbation of COPD. Examples of inhaled steroids include fluticasone, that comes with the name of Flovent HFA, budesonide, that comes with the name of Pulmicort Flexhaler. Also, there are combination inhalers. Some medications combine bronchodilator and inhaled steroid. Examples of these combination inhalers include fluticasone and vilanterol, that come with the name of Breo ellipta, fluticasone, fluticasone, omecilidinium, and vilanterol, that come with the name of Trelegy ellipta, formoterol, and budesonide, that come with the Symbicort. Well, this is sort of my favorite. I have been prescribing Symbicort to a lot of patients. Combination inhalers that include more than one type of bronchodilator also are available. There are some. Here are some examples which I should tell you. Acetylenidium and formoterol, that come with the name of Duaclir, Pressor, albuterol, and aprotropium, that come with the name of Combiment, Respimat. So these are some examples of combination inhalers. Then the next option is oral steroid for people who experience periods when their COPD becomes more severe, called moderate or severe acute exacerbation. Short courses, for example, 5 days of oral corticosteroid, may prevent further worsening of COPD. However, long-term use of these medications can have serious side effects such as weight gain, diabetes, osteoporosis, cataracts, and an increased risk of infection. And then there's a treatment that comes with the name. This option is phosphodiesterase 4 inhibitor. A medication approved for people with severe COPD and symptom of chronic bronchitis is roflumilast, that comes with the name of Daliresp, which is a phosphodiesterase 4 inhibitor. This drug decreases airflow inflammation and relaxes the airway. Common side effects include diarrhea and weight loss. Also, there is an option to use theophylline when other treatment has been ineffective or if cost is effective. Theophylline, which comes with the name of alexophylline Theo 24, which is a less expensive medication, may help improve breathing and prevent episodes of worsening COPD. Side effects are dose-related and may include nausea, headache, fast heartbeat, and tremor. So tests are used to monitor blood levels of the medication. Antibiotics. Respiratory infections such as acute bronchitis, pneumonia and influenza can aggravate COPD symptoms. Antibiotics help treat episodes of worsening COPD, but they are not generally recommended for prevention. Some studies show that certain antibiotics, such as azithromycin, prevents episodes of worsening COPD, but side effects and antibiotic resistance may limit their use. Then there are lung therapies, which I should tell you. Doctors often use these additional therapies for people with moderate or severe COPD. The first is oxygen therapy. If there is not enough oxygen in your blood, you may need supplemental oxygen. There are several devices that deliver oxygen to your lungs, including lightweight portable units that you can take with you to run errands and get around town. Some people with COPD use oxygen only during activities or while sleeping. Others use oxygen all the time. Oxygen therapy can improve quality of life and is the only COPD therapy proved to extend life. Talk to your doctor about your needs and options. Also, there are pulmonary rehabilitation programs available. These programs generally combine education, exercise training, nutritional advice, and counseling. You will work with a variety of specialists who can tailor your rehabilitation programs to meet your needs. Pulmonary rehabilitation after episodes of worsening COPD may reduce readmission to the hospital, increase your ability to participate in everyday activities, and improve your quality of life. You should talk to your doctor about referral to a program. Then there is a treatment option of in-home non-invasive ventilation therapy. Evidence supports in-hospital use of breathing devices such as bi-level positive airway pressure, that is BiPAP in short form. But some research now supports the benefit of its use at home. A non-invasive ventilation therapy machine with a mask helps to improve breathing and decrease retention of carbon dioxide, which is hypercapnia, that may lead to acute respiratory failure and hospitalization. More research is needed to determine the best ways to use this therapy. And then we have to manage exacerbations. Even with ongoing treatment, you may experience times when symptoms become worse for days or weeks. This is called an acute exacerbation, and it may lead to lung failure if you do not receive prompt treatment. Exacerbation may be caused by a respiratory infection, air pollution, or other triggers of inflammation. Whatever the cause, it's important to seek prompt medical help if you notice a sustained increase in coughing or a change in your mucus, or if you have a harder time breathing. When exacerbation occurs, you may need additional medication such as antibiotics, steroids, or both, supplemental oxygen, or treatment in the hospital. Once symptoms improve, your doctor can talk with you about measures to prevent future exacerbations such as quitting smoking, taking inhaled steroid, long-acting bronchodilators, or other medication, getting your annual flu vaccine, and avoiding air pollution whenever possible. I should tell you there are some surgical options. Surgery is an option for some people with some form of severe emphysema who are not helped sufficiently by medication alone. These options include lung volume reduction surgery. In this surgery, your surgeon removes small wedges of damaged lung tissue from the upper lung. This creates extra space in your chest cavity so that the remaining healthier lung tissue can expand and the diaphragm can work more efficiently. In some people, this surgery can improve quality of life and prolong survival. Endoscopic lung volume reduction, which is a minimally invasive procedure, has recently been approved for the from U.S. Food and Drug Administration, that is FDA, to treat people with COPD. A tiny one-wave bronchial valve is placed in the lung, allowing the most damaged lobe to shrink so that the healthier part of the lung has more space to expand and function. So this is a endobronchial valve. Okay. Also, there is the option of lung transplant. Lung transplantation may be an option for certain people who meet specific criteria. Transplantation can improve your ability to breathe and to be active. However, it's a major operation that has significant risks such as organ rejection, and you will all need to take lifelong immune suppressive medications. Then another treatment surgical option is bullectomy. The large air spaces, that is, which are known as bulli, form in the lungs when the walls of the air sacs, which are alveoli, are destroyed. This bulli can become very large and cause breathing problems. In a bullectomy, doctors remove bulli from the lungs to help improve airflow. Okay. So these were the treatment options which I have just told you. Now I should tell you some lifestyle and home remedies. If you have COPD, you can take steps to feel better and slow the damage to your lungs. You should control your breathing. You should talk to your doctor or a respiratory therapist about techniques for breathing more efficiently throughout the day. Also, be sure to discuss breathing positions, energy conservation techniques, and relaxation techniques that you can use when you are short of breath. Clear your airways. With COPD, mucus tends to collect in your air passages and can be difficult to clear. Controlled coughing, drinking plenty of water, and using a humidifier may help. Exercise regularly. It may seem difficult to exercise when you have trouble breathing, but regular exercise can improve your overall strength and endurance and strengthen your respiratory muscles. Discuss with your doctor which activities are appropriate for you. Eat healthy foods. A healthy diet can help you maintain your strength. If you are underweight, your doctor may recommend nutritional supplements. If you are overweight, losing weight can significantly help your breathing, especially during times of exertion. Well, on my channel with BP, I have posted a video about top food that increase your strength and immunity. You should also watch that video. That is also useful. Okay. Also, you should avoid smoke and air pollution. In addition to quitting smoking, it is important to avoid places where others smoke. Secondhand smoke may contribute to further lung damage. Other types of air pollution can also irritate your lungs, so check daily air quality forecast before going out. See your doctor regularly. Stick to your appointment schedule even if you are feeling fine. It's important to regularly monitor your lung function and be sure to get your annual flu vaccine in the fall to help prevent infection that can worsen your COPD. You should ask your doctor when you need the pneumococcal vaccine. Let your doctor know if you have worsening symptoms or you notice signs of infection. So this was my video about COPD. I hope you have enjoyed this video and it should be helpful for all those patients who are suffering from COPD. And till now, if you haven't subscribed my channel, please subscribe it so that, and also do not forget to click the bell icon and select all options so that all upcoming videos are delivered to your inbox straight away. And if you think that my video provides some sort of benefit, even it is a little benefit, please do not forget to give a thumbs up to this video, because that will give me encouragement to produce more useful videos such as this one. Okay. And also do not forget to share my videos with other people through social media such as Facebook and Twitter, because this channel of mine, with BB, is basically created to help humanity across the world. So by sharing my videos to other people through social media, you can also be part of this great initiative. Thank you so much for watching this video. See you in next video. Bye for now.